Thank you for joining us. It's Dr. Jenn with Aging Advantage. And in this third part, we're going to really, again, just continue taking a deep dive into some of these categories a little bit further that Dana and Madison from the health department originally shared with us. And again, I just want to share just again, a little bit deeper kind of thought-provoking thoughts and ideas with you guys around some of these topics that are absolutely crucial that I think everyone needs to know a little bit more about. And also in this particular part too, I'm going to share some really cool tips and tricks with you guys on different ways to help support for decluttering and hoarding and different health tips and tricks and different things that can be affecting your different body parts, like your eyes and your gums and your sleep apnea stuff, so sleeping things, even genetic testing, family history, etc. So there's a lot of different things that we're going to be talking about in this kind of third piece that I'm just so excited for you guys to learn. So anyway, again, Dr. Jenn with Aging Advantage. We are a non-for-profit organization here in the St. Louis area. We serve St. Louis and the surrounding areas. And we are able to partner with incredible organizations like the health department for all of you through grant funding and donations to be able to provide educational topics such as this. And through those kind of, educational opportunities and just different topics that we're able to share about, we're able to really help you all with the post-pandemic effects of housing issues, food isolation issues, just isolation in general issues, and really help to promote more self-reliance and resilience, self-confidence, and help you also learn the tools and the skills to be able to live your life more independently. And also different ways, again, for you guys to kind of observe what's happening in your life and in others' lives around you so that you can live, more purposeful, more fulfilled, more present, and more active, physically, mentally, spiritually, socially, all the things, and emotionally, engaged lives for your own life and also, for supporting people around you. So I'm just excited for you guys to join us again and sit back, relax, again, grab your drink, and let's get started. Too that I love is at home, even doing something simple as a walking pad or treadmill, little stationary bike, or keeping resistance bands, or also some little weights, etc. in your living room area. So when you're watching TV, you are moving it. Maybe that's even, when you're watching TV during commercials, that's your time. So you're going to do, some arm curls. You're going to do some, sit to stand off the couch and, get those leg muscles engaged and get that blood pumping. But you can sneak in movement sometimes that way, even when you're watching your favorite show, so that it doesn't necessarily feel like you're exercising, but you're going to be lifting those weights, when you are, when you're doing your show. And sometimes that can be, again, a nice sneaky little way to get in a little bit of extra movement, which I love. Next, let's talk about sleep, because I think this is really important as well. So as we age, we know our sleep patterns can often shift, and many people notice that they get sleepier a lot more often as they age, but at different times of the day. So often, a lot of times, in the afternoon or the evenings. So if that is you, pay attention and just honor that natural rhythm that your body is shifting and it's changing, and it's okay. So what you would do, avoid trying to schedule appointments and outings and driving especially during those times, or dinner, or outing with friends or family, because your body is kind of winding down and you don't want to be falling asleep. So, but speaking of driving, public service announcement, no. Speaking of driving, please, if you get drowsy or you tend to get drowsy a certain time of the day, do not drive and get behind the wheel. It's not safe for you, or anyone else for that matter on the road. So don't do it, please. If you find yourself falling asleep, Sometimes too, it can be because of certain medications, but you can also have, narcolepsy, or you can also have, different conditions like sleep apnea. So if you're getting more sleepier or you're more tired, again, you're more fatigued than have been kind of before in the past, or you're kind of just not, as brain foggy, or you're more brain foggy, I should say, than normal, then what you want to for sure do is make sure you reach out to your doctor and talk to your doctor about it, because it could be an opportunity to go see the sleep doctor. And again, you might have sleep apnea. So the encouraging news about that is nowadays, like, they can test for sleep apnea at home, which is nice and easy with home test kits. There's also so much more technology for sleep apnea at home too that we can utilize. That's incredible. So there's different apps, and there's also different kinds of like masks and things like that that can really make it way more user friendly than sleep apnea treatments used to be, and machines in the past, and they can be way more comfortable. But getting this checked out absolutely matters. And as a doctor, like, you guys have to know about this, because when you're not sleeping well at night like that, and you potentially have sleep apnea, whether it's central sleep apnea, I guess, or like peripheral sleep apnea, either one, either one of those. But what happens then is that you're not getting the oxygen in to your body like it needs to all night long while you're supposed to be sleeping. So that obviously can damage your brain, damage heart health as well, kidneys, all kinds of other body organs, pick a body part. But that's why a lot of people then will have the issues, because like they're not getting the oxygen to those parts of the body that they need to be. And yeah, it's a problem. But it can also, again, like, it can also age your organs way faster, and your body way faster than than you need to be. So again, if you can tell something's kind of going a little bit awry, and you're more tired than normal, you're more fatigued than normal, again, maybe you just kind of have like a little more brain fog, definitely talk to your doctor, because again, it could be a sleep apnea issue. It could also be a medication issue, blood pressure issue. There's a lot of other things that can be going on, blood sugar issue, etc. But definitely, please talk to your doctor and bring it up. So let's talk about medication safety next. So what this means is you're going to keep all your medications, including things you might not think of as like medications, which might be like supplements, herbs, things of those nature. Example of this might be like melatonin gummies, that you take at night to help you sleep. They could also be other kinds of gummies, if you're picking up what I'm putting down. So for some of you guys, some of you will also, take like cannabis gummies or THC gummies, or some of you guys even just like take them at night before you sleep to help you sleep, help kind of decrease your anxiety and kind of quiet your mind, etc., before you sleep. But again, you got to keep all of that stuff up, out of the way from kids and pets. Keep all the stuff locked up, because also, like, you don't always know who's coming in your house, right? So especially if you have like any kind of medication for that matter, but especially if you have like opioids or things like that. So you have you can have family, friends, caregivers, whatever coming in your home, and you don't want them having access to your meds and taking them, or taking them with them. So please make sure you have all that stuff locked up. And especially, I think sometimes with some of those medications, like we take at night, right? You might just have them on your nightstand sitting there and think nothing about it. And so, again, like a kid might come up and grab them, and take them. but also, you might have them on the coffee table, or you might have it on an end table or the dining room table or somewhere like that, or even like under the sink in the bathroom. And again, a kid or a pet or something like that might have access to them, and it can absolutely be, it can be deadly, but it can also be highly detrimental. So keep those things like up and locked away and completely out of sight so that someone doesn't have access to them. Another quick thing as well is like your eyes, your teeth, your gums, again, other body parts, right? One thing I think that's really surprising is that for a lot of people, your eyes, again, your gums, your teeth, etc., can actually be windows into your overall health. And as doctors, obviously we know this, so we pay attention to these things, but that's why we want you guys to go get your regular screenings at the dentist and at the eye doctor, etc., because it does all the rest of us type of practicing doctors a favor. For example, it gives us kind of just like, again, a window kind of into your overall health. So example, like eye exams, when you go get your routine eye exam, sometimes it can reveal signs and symptoms like related to blood pressure or stroke risk and things of those nature. If your gums are bleeding, if you floss, that can be a sign of inflammation, like elsewhere in your body as well. That your body might not be doing so hot. So anyways, like if those things are happening, that's absolutely worth mentioning to your doctor. And of course, you want to keep up, with your regular dental checkups and, good oral hygiene. So you're not having cavities, so we don't have teeth falling out and, and all the things like that. Or, if you have a tooth cracked, etc. Just, make sure you are keeping up on those kind of things. Because again, there's a lot of things that can happen in your mouth, even in your mouth. Again, public service announcement, I'm going to go there. But even in your mouth, for example, sometimes you can have like symptoms of different kinds of like STDs or STIs, etc., around your mouth and inside your mouth, throat, etc. region. So again, you got to get these things checked, okay? And again, make sure you're being safe, make sure you are taking care of all the different parts of your body. But again, sometimes getting those things checked can help us other doctors, know, okay, we need to check your, C-reactive protein. We need to check this, inflammatory markers. We need to check autoimmune markers, etc. If you have a bunch of inflammation happening in your body before it starts affecting other organs and really causing a lot of other signs and symptoms that you could have avoided otherwise, potentially. So next, let's dive into something a little bit different about decluttering and hoarding that they discussed. And, obviously these things are going to be a safety hazard. We know this. However, I heard a really awesome presentation and a really inspirational presentation, actually from a photographer several weeks ago when I was at a business conference down in Dallas. And I had the gift of listening to just some really different kinds of unique types of work that her and her husband do. And one of them being that they work with people who clean up other people's houses from, hoarding situations and decluttering situations. And I was like, tell me more about that. So what she said actually was what they do is they will come into the person's like home, and then they will actually take pictures, like physical, pictures of all the person's like items. And some of the stuff, might even be like heirlooms or furniture that's been passed down that like nobody else in the family wants, but they won't get rid of the, whatever coffee table thing. Other times it can be, family photos. It can even be sometimes like really, really cool memoir keepsakes that people have just had, and you keep in boxes. And for some of these people, it is like drawings or paintings or writings or things like that that their kids or their grandkids have done over the years. But again, it's like a very sentimental thing and they don't want to throw it away. And so it becomes this whole like double Dutch catch 22. It's like, okay, well, that's great, but you're obviously not displaying all of these things anymore, like on the refrigerator, like you did a long time ago. Now they're all in boxes and they're piling up and they're causing all kinds of issues. So the cool thing that they do is to take pictures of the pictures potentially or the drawings also and things like that. And they can take pictures of all of these different items. Maybe it's like collectibles. So, for example, like older, older generation. And then, okay, and for fairness, like it still can happen now, right? But a lot of the older generation of men, they would, for example, like collect baseball cards or, like an autographed ball or autographed football or, just different things like that. Some of the women would actually collect like precious moments or dolls or different things of that nature. And so what they can do, same thing, is to actually like take pictures of all of those items. Sometimes people also have like all of the trophies, all the medals, all of the certificates, maybe like work wise or volunteer wise, etc. They have, done all these different certifications or again, like helped or volunteered or donated or whatever it is. And now they have all these different certificates. They can take pictures of all those things so that, the people feel like it's okay. Like I don't need to keep 45 of these things in a frame, in their frames that were at some point hanging on the wall, like in this box. So they can take pictures of all the stuff, which is really cool. And then what they do, 2.0, is then they'll kind of group everything like kind of into categories, right? And then what they'll do is make like picture books, almost like picture albums, right? Of all those different things. And it is so cool. I'm like, that is genius. That is such a great idea. Because when they do that, it's hard for some folks, the whole like decluttering and hoarding tendencies, because it, genuinely is a difficult emotional topic for a lot of people. And, again, that's why they're like holding on to it, because for them, it's not just stuff, it's memories, right? And it's connection and all the things. And so, well, for some people too, it's also a sense of belonging. It's also a sense of identity because, especially for some of these people that get older, maybe they have like Alzheimer's or dementia and they're starting, mentally to not be as cognizant as they used to be. One of the things I think for that, is where this is, it's just so beautiful because if they take pictures of kind of some of those sentimental items and keepsakes, whatever it is, and turn it into the photo books, then, and you can use online printing services for them, etc. Again, with all the technology we have. And again, you can make like one into, like things that he collected, or maybe it's like cars or whatever it is. But you can make it into different, like little books, or you can have it be, one big book or whatever that looks like. But the cool thing is that that book then it can, become also like a family keepsake and that can be passed down, but they can then get rid of and quote unquote, instead of get rid of, we'll call it release, if you will, but they can release all of those physical things that have been, around and again not making it safe for them and their environment, etc. But they can release all of that stuff physically. And then the beautiful thing is they now have this absolutely stunning like these little like books that they can take with them when they go to the assisted living place or the independent living place or nursing home or wherever it is that they go next. And I just think that is such a gift. That is so beautiful because they can then share that. again, with younger generations, when they come over, they can sit down, they can get out the album, they can go through, some of the different things. And it's a great way, for other generations to learn about them and about their life. And maybe it's like pictures of different vacations they went on, or, whatever that is. Or maybe the different farms that they had and the different types of cows or the crops they grew, or I don't, just whatever it is. But it's a great way to kind of share those memories with other people. But also, it's a really cool way, too, again, once they move and transition from being in home to an assisted living or independent living place, when they don't feel like they have anything, around them a lot of times that's familiar to them. Especially again, like if they have Alzheimer's or dementia, whatever, you can get those books out with them and they can look through them. And it helps to keep them like mentally sharp. It helps keep them connected. It helps them feel, safe and grounded and secure and, like attached to something again, from a memory standpoint. Even pets, like pictures of pets and things like that. So it can really be very like calming and very soothing to some of these people. And I was like, that's genius. Like that is so, so beautiful, but also for the people around them, right? So they're new friends that they're going to make at some of these places, or even some of the administrators or some of the people that might be caring for them. They can also like grab some of these books and flip through some of these things and learn about, maybe for, the woman, like maybe her husband passed several years ago, but they can grab some of these books and they can learn about their whole life. And so it allows them to show up better. As well, from a caregiver standpoint, I think, or, again, even them trying to make new friends, which is hard, as we've talked about in other education series, opportunities that we've given you guys. But it's hard for them to make other friends as they age. And so, they kind of can have these little books as road maps, if you will, and kind of as talking points that they can, share with their new neighbor person or people that they sit at the dining room table with, at the assisted living place when they move there. But they can share some of these things, and then it can cue some memories and some stories to help other people, again, like learn about them and familiarize themselves with their life, and also relate to their life so that they can make new friends and have some talking points, sometimes as well, a little bit easier, instead of, sometimes like they don't know what to talk about with someone new. But it can, like, again, give them like a grounding thing and like a springboard to like, let's have some of these conversations, especially when they don't know what to talk about. So it can be a beautiful thing, as you can tell. Very passionate about it. But yeah, it was just, like I said, it was such a gift that this incredible businesswoman shared when she talked about that. I was like, that is genius. Like, yes, we need to do a lot more of that, I think, for people. But again, they can release all the stuff, and then it becomes a safe environment. So, so it's not, so it's not like a fire risk, or it's not, again, like a fall risk, and, and all those things, from the standpoint of like hoarding. So, the next thing is talking about the generational stuff, etc., is talking about like family health history. And this is a really like simple, but really powerful point, I think. So keeping track of your family's like health history is absolutely, key. And I'm very blessed. Like my grandma on my mom's side did an excellent job with this. She, like kept track of her different appointments, and, when she would got cancer again, and when she started treatment again, and when she did this, and when she, had this surgery and that, and, things like that. She literally like journal, like wrote it all out, which was great. My mom does a really great job of keeping track of blood work. She has spreadsheets for all these things. So you can see blood work trends over all the years and all the things. But, again, she's like done a lot of this stuff for herself and, and for me and, just different people in our family. So it's kind of like her little niche and she does great with that. But I think it's just important to know, like especially for somebody in your family, like if you have a history of, prostate cancer or breast cancer or allergies, also too, like medication allergies. Like if somebody in your family has, like a sulfa allergy, or like one of your parents, for example, has like a sulfa allergy or penicillin allergy, there's a higher likelihood, not always, but there's a higher likelihood that you're also going to have that yourself as well. So just keeping those things in mind is key. But also now, as well, because we have the beauty of genetic testing, which as a doctor, I love, because we can just do a really easy cheek swab on somebody and again kind of like know their genetic profile, and it's a beautiful thing because I can then know also, again, if somebody's going to be more susceptible to getting a certain type of disease or not, or again like with breast cancer, somebody's breast cancer risk, I can know that profile, etc. I can also know with genetic testing as well how somebody is going to react and respond to a particular medication, like med family, if you will, like family of meds. Because there are different pathways that different medications get metabolized through. And I can learn about the person if the person's going to be a fast metabolizer, a slow metabolizer in that particular pathway that medication gets processed through, or if they're, just nice and steady, normal processor. That will help me to know if the person is more likely to have like side effects and issues taking that particular family of kind of medications, or also if that person isn't responding to the dose that we gave them, that goes through that particular pathway. They just in their depending on again how they process, fast, slow, etc., they might need a higher dose of that medication for them to have the same effect as somebody else, and all the things. But anyway, knowing the genetic profile also too, though, again, like of your parents, can help also for you to know how you're likely to react and respond. Sometimes, again, getting your own genetic testing is really important, but the things that they are potentially more reactive to, or that they are more at risk for, likely you're also going to be more at risk for. And sometimes too, again, these can be like autoimmune conditions, etc. So, knowing these things, I think is really, really powerful. And, and one of the like tips and tricks that I've learned is actually for, people in my family, or even like, sometimes even this can roll over into like, my friends or people that I'm around too. Sometimes like business partners, acquaintances, etc. too. In the person's contact. So like in my phone, under the person's contact in the note section, I will put in there that person is allergic to penicillin and sulfa, or that person is, allergic to gluten, is allergic to dairy, is allergic to seafood. Maybe they're also, allergic. We have somebody in my family that is allergic to tree nuts, all kinds of different things like chocolate, whatever it's going to be. Sometimes it can be common things and sometimes not so common things. But again, same kind of things from like a medication standpoint. If somebody like doesn't do really well, like with Bactrim, but they do really well with a different kind of antibiotic or something like that, you can put all of that, in somebody's notes right in your phone again, so that you have it with you at all times. Because what if that person, winds up like in the hospital? Like what if, your parent or whatever winds up in the hospital and you have to go, you can say like right away, if it's not on their profile, like, yes, they're allergic to this and this and this and this. They don't do well with these things. And it keeps them safe. And it keeps you, also like well informed. But again, if you have somebody in your family that has had like breast cancer, colon cancer, kidney issues, whatever, just, brain cancer, just different types of things. Sometimes also too, like in families, genetically, again, people can have like clotting disorders that will predispose you to having more clots, like blood clots. That's going to predispose you to having more strokes. That's going to predispose you potentially also to heart attacks, then, and some other things potentially. So, knowing those like genetic risk factors will help to keep other people in your family safe and also help to keep you safe. So, use that little tool, use my little tip trick, take it with you. And yeah, again, like in the note section in your phone, just write some of those things down. And I love it too, because again, from like that food perspective, like I shared, especially, if people have food allergies or sensitivities or things like that too, or just again, like health history risk. I know, like if I'm going over to, my stepsister's house, or maybe even, for example, this is kind of like, a little 5.0 here, but like we have a lot of people in my family that are, need to be, again, dairy free. They need to be gluten free. We have some people, again, by choice, that are vegan, they're vegetarian, just different things. We got a whole list of different things going on. But when we have Thanksgiving, you can imagine how that goes, right? So it's a challenge sometimes to figure out, okay, yes, like one of my brothers is allergic to seafood. So, okay, we're not, nobody's bringing like a shrimp cocktail thing over, right? Or if they are, he's like not getting anywhere near the thing. So anyhow, but just knowing those things can help you be respectful and safe, again, like for your family and people around you, but also it helps to give you important information, for yourself and your own health kind of moving forward as well. And speaking of that, I want to talk a little bit too and expand upon how they talked about screenings. And I think, like as we get older, right, regular preventative screenings are so important. And, again, like looking at things like we just talked about, like blood clots or, stroke risk screenings or doing, colonoscopy screenings, mammographies. So like breast, screening things, as well as like OBGYN land, doing like pap smears. And, a lot of times it seems like, at least, it's like we hit a certain age and then all the doctors are like, oh, you're good, you're fine. We don't need to do any of the screenings anymore. But I, as a doctor, have seen so many times that, continuing to do some of these screenings has actually caught, either those kind of conditions or other things maybe that were like living near that area, that accidentally got caught, and we all know so many people that's happened to, right? And so anyways, like the accidentally catching thing, super bonus points, right? So, I know like there's a big push right now from public service announcement. No, there's a big push right now for insurance companies to kind of mandate down to some of the doctors. And then the doctors are, again, like not recommending after a certain age anymore for people to do their annual wellness, prostate screening or this kind of screening or that kind of screening, whatever it's going to be. But again, insurance, a majority of the time, almost all the time, will still pay for those. So I always try to empower you guys, again, as the patient, like you're the patient, you're the quarterback, you're the one. I mean, like, yes, us doctors can give you recommendations, but you're the one, honestly, that has to drive your own health. So advocate for yourself, guys. You have to speak up. You have to say, like, yeah, like I get it, but this isn't like necessarily a recommended, thing yearly, but like I still want to do this. Can we, I still want to do these things, yearly, or like, colonoscopy might be every 5 years or whatever it is, but like I still want to participate in these things, please. And, and again, hopefully your doctor goes along with it, for you. And if not, switch doctors, if you need to. But typically, again, these things are covered. And so you need to do what feels right for you. And again, don't, like, just please, please, please don't hesitate to ask, because it's your body and it's your life. And one of the things too, I think, especially, even for women, men, whatever, all the things, is that also that I'm gonna gently kind of mention and throw out there that's important is that, middle age and older adults now have the highest rate, as they talked about in the presentation, but they have the highest rate of sexually transmitted diseases and sexually transmitted infections, right? Like STIs and STDs, and of any age. So, could you imagine if we stopped doing, screenings at some point on people? Um, but maybe sometimes, people might not have symptoms, but like we need to know these things, right? But, that being said, if you notice anything unusual, like you have pain, burning, discharge, discomfort, reoccurring UTIs, different things like that, rash, something like that, skin changes, ulcerations, etc., things like that. Please be sure to talk to your doctor and get these things checked out. And, ultimately, like it protects you and it protects everyone around you so that you're not, giving it to other people. So please get checked. And thank you. Anyway, next thing and last thing is, how they discuss gun safety. And I think obviously, with today's day and age, this is like really, really important, especially around the city of St. Louis. We need to talk about it. We need to keep talking about it more and more. If you or a loved one in your household owns a firearm, or somebody that you're around has a firearm, keeping it locked up, obviously, is one of the simplest ways to prevent accidents from occurring. But the City of St. Louis Fire Department, along with select branches of St. Louis Public Library, can, and there's other organizations and resources too, but those are sometimes like, the easiest kind of most, I guess, easiest ones to think about, if we will, from an accessibility standpoint. But they provide free gun locks and gun safety information to the public through the Lock It for Love program. Really cool program. Look it up. But it costs nothing. That's the biggest key. And just takes a few minutes, and it adds one more layer of protection to your family. And what I love is, how Dana and Madison in their presentation, go back and look at that section where they actually showed you all like pictures of what the gun locks look like on different types of guns. And I just think that's so powerful. Again, just from a visual aid standpoint, to know like what it looks like when you put it on there properly, etc. And again, only takes a couple minutes, but it is absolutely key for safety for yourself and for, others around you. So thank you all again for joining us. And, that wraps up kind of like some of the expanded look that I wanted to provide to you guys in the healthy habits for aging well category here. And again, right here in the city, of St. Louis, we have so many incredible resources, and in our surrounding area, as well. So again, just huge thank you to Dana and Madison for, doing the original presentations for us that really helped to kind of just inspire some of these extra thoughts and some of this confirmation for you guys. So again, if you found this helpful, we would love for you to follow Aging Advantage on Facebook and subscribe to our YouTube channel, where you're going to find more videos and more just helpful education content like this for all of you. So thank you so much for watching, and we will catch you guys next time. And until then, take care of each other, stay safe, stay confident, and, again, get out there and just interact with one another and really support one another and show up for yourself and for others. Thank you.